Hello everyone. Today is September the 16th. I'm Dr. Adam London, Director of the Kent County Health Department. Here in Kent County, we're currently reporting 8,367 diagnosed cases of COVID-19. We're seeing an average of about 45 new cases per day over the course of the past week. That's up a little bit from where we were at last week when I spoke to you. At that time, we were seeing 35 to 40 new cases. We've also seen that our positivity rate has gone up a little bit. We're now at 2.5% of all the tests that are done of Kent County residents coming back positive. Last week and for the last several weeks, we've been at or below 2%. So overall, we're still standing pretty good. It's good that the number of cases right now is sustainable and we can keep up with that case investigation and the contact tracing work that goes along with those cases. And that positivity rate is still below 3%. Which is generally seen as one of the markers of concern. Once you pass 3%, things are getting worse again. Our deaths are currently at 163. So we have seen a couple of new deaths over the course of the past week. And once again, our thoughts and our prayers go out to everyone who has lost someone during the course of this pandemic. So today I'm going to ask you to step in a time machine with me for a moment. And we're going to go back to March of this year. And if we did that, and if you sat with myself and my team as we discussed this pandemic and the things that concerned us going forward, you would have heard about a number of things, including 4 large hurdles that we were looking at as concerning points in the course of this epidemic. The first would be bracing for impact and preparing for the arrival of this virus in our community. Back in early March, we didn't have any positive tests at that time, but we knew that when a virus like this, that is as contagious as it is, first arrives in a community, everyone is vulnerable, and these things often arrive and cause maximum disruption and problems at the front end of the pandemic. And so those were the flatten the curve days, as I'm sure everyone remembers. And we successfully cleared that hurdle. This community did a great job in bracing for impact and flattening the curve. The next hurdles that we looked at going forward were school resuming in the fall, the weather changing in the fall and into the winter, and then the arrival of vaccine and making sure that we had the logistics and the operations in place to distribute vaccine in a way that is safe, that accomplishes herd immunity, and that doesn't create a lot of social gatherings in and of itself. But right now, we're in those 2 middle hurdles. School has started, and our school administrators at all levels have done a tremendous job in working with us to make that school environment as low risk as possible, and our weather is changing. And as the weather changes, people are spending more time indoors. Windows and doors are being closed more often, and we know that the colder weather generally presents a higher risk for respiratory viruses like influenza and probably like COVID-19. Now, we've never seen COVID-19 during a fall or a winter scenario here, and so we've got a lot to learn this fall. But we know that we're in a very delicate position right now in our community. Schools are starting, the weather's changing. And so I want you to consider that during the month of September, of all the tests that we've done, of all the positive tests, the cases that we've identified, 17.9% of those positives have been within people between the ages of 10 and 19. And an enormous 35.2% of our cases in the month of September have been people between the ages of 20 and 29. And this is telling us that young people, and especially as we go back to school, that young people are an enormous dynamic in the spread of this virus. And right now our investigators are not seeing that many of these cases seem to be linked to the in-person classroom experience. Now certainly some are, but by far and away we're seeing that social gatherings are the risk point, is the point of exposure where so many of these cases are happening. So, we really want to encourage the young people in the community to do their part to make it difficult for this virus to spread. Now, there are some who would say, what's the big deal? We know that young people are typically very healthy, and we see very few severe health outcomes associated with COVID-19 and that younger, healthy population. Well, there's a couple reasons why it is a big deal. It's a big deal because, first of all, it's a wrong assumption to believe that all young people are strong and are going to be resilient to this virus. We know that lots of young people do have underlying health conditions, and not everyone is going to heal or recover without harm from COVID-19. But we also know that colleges and schools don't exist in a vacuum, and that the students who attend those schools, they also work in the community, they shop in the community, they interact with people throughout the neighborhood in a way that can spread this virus to other sectors of the population. And that's where our concern really elevates whenever we have any portion of our population dealing with an intense outbreak of COVID-19, we're likely to see that spread and spill over into other parts of our community. And so that's why we're encouraging everyone, but especially that younger population, to continue to wear facial coverings, to socially distance, and that includes both maintaining 6 foot of separation in public spaces. It also means avoiding large social gatherings that aren't necessary. It involves staying home when you're sick and making good choices about where and when to be in public spaces. And hygiene, hand washing, and making sure that we're disinfecting surfaces that can be places where the virus spreads from person to person through touch. Do these things. I know that they're inconvenient. I know they can be difficult. I know it's a bit of a sacrifice to give up those social gatherings. Ideally, we know that everyone would like to get out and to participate in the social life of our community more often and in a way that we're used to. But we're encouraging you right now, for the sake of everyone's health, let's be smart about this. Let's stay positive. Let's stay heroic, stay healthy, and do what we can to help protect each other. Thanks for watching. I'm Dr. Adam London with the Kent County Health Department, and I'll talk to you again soon.